All right, welcome. Thank you everyone so much for coming. Whether you're in the room or online, I wish I was like double-sided so I could see everyone and talk both ways. I'm a part of the Electrifying Africa's healthcare team, and today we're presenting on a phased accumulation of solar power production. Our sustainable development goals are number 7, affordable and clean energy, and number 3, good health and well-being. My name is Carly, I'm from the United States, and our facilitators are Ella, also from the United States, and Boaz from Pakistan. As we go through the presentation, our group members will introduce themselves as we move on. So to really understand our solution, we invite you to picture the following situation. Imagine you live or you just moved to the Democratic Republic of the Congo. And this is the house that you share with your family. A few weeks into our imaginary scenario, you start not feeling so well. Your heart is racing, you feel tired every day, no matter how long you sleep. And one night, as you're getting ready to go to bed, you notice that your fingertips have turned a little bit blue. And as you're getting ready to go to bed, all of a sudden you're really short of breath. And eventually you decide that you should probably seek some medical attention. So you walk to the clinic. It's about a 15-minute walk. But by the time you reach the clinic, the sun has gone down and it's almost pitch black outside. So this is what the clinic looks like. You don't feel well enough to walk home, so you decide to go into the clinic and wait to be seen. The clinician takes your vitals and tells you that your oxygen level is down, probably from a sickness you had a few weeks ago. But after a few hours on an oxygen concentrator, you should be feeling much better and be ready to go home. That's great. After a few hours, you can be on your way comfortably back home. However, the clinician tells you that the power has been out to the clinic all day, and they're not sure when they will have power back. They advise you to stay at the clinic, and for several hours, you wait in the lobby, tired and in pain. Just before the sun comes up, the power comes back on, and you're able to receive your medical attention. As promised, within a few more hours, you're feeling much better. Your trip to the clinic took you almost half a day, but you are just happy that you're able to return home safe and healthy. This is the end of our imaginary scenario, but for many parts of the world, this is a stark reality. This brings us to our problem state. In sub-Saharan Africa, only 40% of health facilities have access to electricity, and 28% of those have reliable service. Across the entire continent of Africa, there's inequitable distribution and inadequate buy-in for electricity, specifically for renewable energy sources. Our presentation and our solution is using the Democratic Republic of the Congo as a frame of reference because it's one of the largest countries on the continent with one of the lowest access to electricity rates. Our preferred state is no matter how long it takes, we'd like to see a world where 100% of clinics and hospitals in sub-Saharan Africa have access to clean, reliable, affordable, and abundant energy. We prefer that this energy system be sourced from materials in the operating country, owned by the local community, and delivered with training for both local technology specialists and clinicians. And we really want these energy systems to take into account any and all systemic barriers that have kept Africa from equitable access to energy to make them more sustainable in the future. Our strategy is a model to facilitate investment and integration of renewable energy technologies in the healthcare sector of Africa. This focuses on small, phased developments that can be applied in multiple areas, either sequentially or at the same time. And we plan to do this by partnering with non-governmental organizations that are focused on energy access and targeting communities with an identified benefit, appropriate existing healthcare, as the scope of this project does not include supplying or rebuilding clinics, and proper geographic conditions for the current solution, which is currently solar. This brings us to stage 1 of our model, which is standalone systems. So with a small starting investment, one that governments, NGOs, and communities may be comfortable making, even if they aren't sure about solar power yet, we could see communities and clinics begin to integrate solar energy. With just one single 400-watt panel, clinics could power light bulbs, laptops, phones, and fans. With 3 panels, clinics can power lighting as well as basic medical equipment for up to 10 patients. And after overcoming regional concerns with solar, be it cost, effectiveness, safety, ownership, etc., and local technicians becoming more acclimated to the system and the clinic securing more funds, the system can begin to be upgraded. Once more solar panels are added and more materials are included, a clinic can reach microgrid status, which we consider for the scope of this project to be greater than 3 panels. They will be able to store a certain amount of energy with these panels for either a cloudy day or a day where they just need to use more energy than they're generating. With enough investment, they will be able to purchase additional equipment like solar generators to increase their capacity. With even more investment in the growth of the system, the clinic can reach mini-grid status. And with even more capacity for storage and generation, we will see clinics be able to actually distribute this energy either through direct connections or battery pickup services to their local community. And at this point, I'm going to pass off to my colleague, Elliot.
Hi, everybody. My name is Elliot, and I'm also from the US. So with this project, we hoping to increase the quality of healthcare in the targeted community. It will also allow access to healthcare as well, and community engagement. This will bring the community together, provide business opportunities, provide jobs for local people, and increase the material supply that comes into these communities. For our standalone grid, we will need three panels, which will produce around 1 kilowatt of energy. And the microgrid will require 15 panels to produce 5 kilowatts, and the mini grid also 70 panels. This will help be sufficient enough to power medical equipment and also phones, laptops, and the local provide electricity for the local community as well. For technologies, we hope we get a solar. We need solar panels, controllers, inverters, transformers, batteries, and generators. And for human resources, we hope we get engineers, project managers, community people to help. This will also provide them with new skills so they can use that in their business as well. We also need clinicians because one of the problems that came up is they may have these new equipment, but they will not have anybody else to utilize it. So we will need clinicians to utilize this project. And we want to make this community based as possible so that the people in the community benefits the most from this organization. So for our costs, we would for the standalone, which requires three solar panels, that will cost approximately $2,000 in US. But when we transfer it to the Congolese franc, that will be around $6 million. For the microgrid, that requires 15 solar panels. That also cost around 15,000 US dollars and 38 million in the Congolese franc. And for the mini grid, that is on the larger scale. As you see the trend, as it increases, the amount, the quantity of the solar panels, the price also increases. So that will be around 68,000 in US dollars and 165 million in the Congolese franc. Uh, Installations, this varies. We can this all this is in the United States dollars, but we can get people from Congolese who may do it for cheaper price. For installation, we will that is 700 per panel, battery installation is around 2,000 to 35,000, and generator will cost $3,000. And we're hoping to train technology specialists from these local communities. If we don't want to export them from other countries to these places, we want to train these people and so that they can take over when the project is done. So that will also cost us around 250,000. And maintenance costs also uh, will cost us 140 to 180 per the year. So we can train these community people who would take over and maybe also do it for free as a community service as well.
Um, Hello, my name is Mohammed Ryan, also from the USA. I'll be continuing the presentation from here. All right. The next step for our module would be sorting out the materials, holding trainings for clinicians and technology specialists. We do this to give them an understanding of how we're going to actually integrate our module into the communities. We would also identify the correct communities for implementation by surveying them, making sure that they're correct for our module. We would also hold community meetings for stakeholder feedback. Over the next 6 months, we would already implemented the first model into the community, tracking the health and economic increase indicators. We would focus on those indicators specifically and to help us refine our system, in addition to also sourcing our funding from the stakeholders. We would also be at stage 1 in the second community, and we would repeat this process, adding more and more communities to increase the awareness. We So to engage our stakeholders, we would understand their interests and needs. This would help us build a relationship with our stakeholders. And we would also collaborate to seek out input from NGOs, whether that be from Alltech, which is a DRC-owned company that provides affordable renewable energy to the underdeveloped communities in the DRC, or we could seek investments from the government, like the United Nations Capital Development Fund, which help fund different underdeveloped countries, such as the DRC. And you can take a look at some of the other stakeholders. Go on to the next slide. All right. So stage 4, we would be we would be constantly repeating the same steps, expanding into new communities, and with small incremental investment, this will help generate wealth for the clinics to reinvest into the communities. And it is a slow progress. It is a slow progress, but I think it'll move really fast. Thank you. This is the end of our presentation.
And now we'd like to open up the floor to feedback from anyone in the room or online.
Ask a couple questions.
Yeah, of course.
I was curious about the word technicians. Is that you're not talking about health technicians? You're talking about solar panel clinicians, or so? Or there's two different. There's technology specialists and clinicians for both solar panel experts. Or
Yes. So the question was some elaboration on the technicians and the clinicians. And are they solar panel experts? And then do you have nurses and doctors? And yes, they are two separate entities. We have one group of technical experts that we would recruit in the communities and train on how to maintain the systems. And then also the clinicians or nurses and doctors in the clinic would already be there. but we would train them on how to address any injuries that might result from the introduction of the system, like electrical shocks, cuts from the glass, things like that.
Understood. I think it's, wonderful. I don't know if can they hear me? Should I move over?
Yeah, they can hear you.
They can hear me, okay. So I'm a faculty member here at the School of Entrepreneurship, so I have to ask, have you thought about partnering with any universities from, like, with engineering projects from outside of the country or outside of Africa? And the reason I'm asking is, for example, in the US, there's a lot of grant money, and sometimes even donors for universities will donate money for students to go work on projects, in a particular area. So, for example, we have students working, we have a faculty member and students working with young women in Kenya, and that's all paid for by a donor. And so I'm thinking that there might be a way to just explore it as an option as to whether or not there are US universities, or maybe British, I don't know, but that would just send their students over for, with help with installing and all, so sort of for kind of free labor. And the other thing is, because, so free labor, and the last suggestion I have is, in terms of solar panels and all of the supplies, that some places are donating things like that once they've been used in labs at universities or maybe even companies, so that as long as they're still working, but not necessarily having to buy new, but finding out, and I know that there are even companies that are exporting to different places in Africa, technology that is no longer used here, but is working, so those are my suggestions.
Thank you. That was really wonderful. And Carly, if you kill the screen share, it'll be more people. There'll be more real estate for the people who are giving feedback, and so more people will be able to see everybody.
Yes, Matthew.
And yeah.
Hello.
Anthony,
So thank you. There's a really good, insightful, and well thought out presentation. As you look forward in terms of implementation, I will look at the extensive work already done in like energy access in Africa. In fact, I co-authored one when I was at the World Economic Forum that looks at the barriers and challenges. I would also look at financing models. There are all emerging financing models, blended financing models. Some of the entities, African Development Bank as one, is doing substantial work in energy access, looking at kind of the financial models they have in place. I would also look at how do you project various outcomes. So health outcomes is kind of probably a phase one effort, but also a lot of the energy access analysis in Africa is also about educational and economic outcomes. So kind of build that into kind of the packaging as you would do it. I was a little bit unclear of the role of generators that was referenced, because as I understood, this is entirely a solar-based installation coupled with batteries. A little bit unclear about the role of generators there. So those are my observations and questions.
Yeah, so really great feedback. We'll definitely think about that when we're making the report. I can elaborate on the generators. There are a few types of small solar generators that can be used as a backup. So you can connect, it's almost really more like a battery, since you already have the solar panels. You're charging that to be able to be taken off and used somewhere else as its own system. So it is a entirely solar system, and not the generator isn't powered by fossil fuels.
Elena, if you can speak.
Yes. Hi, everyone. Thank you. First off, I want to say congratulations to the team. I really loved the storytelling element of your presentation and how you really helped us walk through the actual experience and then went into kind of like the nuts and bolts of the project and really marrying this energy access challenge with an actual development objective like healthcare is also really smart. So congrats for that framing. I think the only thing that I would give as far as critical feedback is I really want to see the business plan for this. So I understand that you gave some of the cost for the actual solar panels, but we all understand that they have a specific lifetime and there's a specific upfront investment and then ongoing operating cost. And so really just understanding what those costs are over a specific period of time. So then you can also understand what you might need from different stakeholders, whether it be a bank, whether it be an investor, whether it be the local community that's going to be paying fees to maintain these things, whatever that be, but really understanding a little bit deeper about the cost and operating costs and on an ongoing basis. And that's also how you're going to get scale, like showing that this is an actual viable, profitable business model is how you're going to get the CapEx investment to then pilot this somewhere and then scale it, which I know you mentioned in the presentation, but really showing that there is a value and that there is a sustainability in this as a business for the local community, coupled with those extra positive externalities as far as the health benefits and providing the service to the community. As much as you can quantify that and really put it together would just tighten up your presentation that much more. That's it for me. Thank you.
Thank you so much.
Mr. Kavuna, I don't know if you're there.
Yes, can you hear me?
Yes.
First of all, congratulations, Amari, what you did. I can see that you did research, good research on that, and good job. And just wanted to remind you, you said it's a scenario that you did, but coming from the Congo too, what you did there is a reality. So it's not just something you thought about, but it's a reality. So I encourage you to applaud you for what you did research. And I don't want to take too much of time, but I applaud you too, the collaboration that you do, you thought about with some NGOs and some institutions. But I just wanted to I also want to encourage you to look into working with young people in those communities, because they can bring in not only labor, but also expertise, some insight too, and some not only expertise, insight, but also some ideas that you may not know being on the ground, in the ground, so on the ground, I'm sorry. So it's something I encourage to work with young people in those areas. But if, again, job well done, and then looking forward to working with you on this area.
Thank you for the feedback.
If Jim here, Jim Carverby.
Yeah, so I'd also like to sort of echo the kudos that shared by others. A few comments and questions, sort of thinking about this from a broader systems perspective. First is, I know there's other projects doing this. I know USAID has a big program. So how does this differ from those? And what's the sort of marginal benefit of doing this on a small scale rather than partnering with multi-million-dollar global clients, especially in this field? Second question goes back to a question of the business model, because you can't just install solar panels on one building and have enough of a market to train people and make that sustainable business. So the real question is, how do you develop the funding infrastructure to drive the need to keep these people employed after training? Because if the idea is to go to communities one at a time and train people to install and maintain, they're going to have other sources of income, because this isn't enough to fill their time. The third question, I guess, it's again, it's related to the systems, is thinking sort of about the incentive structures and sort of a chicken and an egg about the provisioning of electricity and the need for electricity for medical devices, right? So if you're in a place that doesn't have reliable electricity, they may not have the equipment that they need, which means that the cost of building this out is hard to fundraise for. They don't have the equipment that they need power for. So your initial cost might actually be substantially higher than just on the electrification side, but also include the cost of the healthcare side. So just thinking about the business model sort of holistically and scale up as it relates to the interplay between electrification and the need for electricity, as well as how the equipment is sustained are definitely business.
Thank you. Mr. Kurt McNamara, I don't know if you're there.
Okay, thanks. So yes, I want to echo the others. That's a excellent project. It's well focused, very practical, very what we might call, excuse me, actionable. And it turns out is very similar to what I have. You know, I'm sitting here in a place we lived for about 6 years that's got a little tiny off-grid system, pretty similar to your basic one. And so just in terms of what you explained, I think the costs are, you know, certainly realistic for US. It may be more in Africa, or there may be shipping costs, right? Battery choices, you'll hear a lot of chatter about, you know, lithium ion versus lead acid. And in my experience, lead acid are just fine for right now, but of course they're heavy as all get out. So that's a big shipping thing if they're not available locally. So there's a few things like that. The discussion on generator, I think you might mean inverter. That term is what turns the DC back into AC. Just FYI on that. Solar panels never wear out. When we moved in here, the existing solar panels were 20 years old. They were still working. They were way, you know, they're ancient technology. They weren't producing much power. So we replaced them and we got, you know, like double the power in the same space or something. The batteries, you know, especially lead acid, do wear out. They've got a finite lifetime, you know, under 10 years, probably better than 7 in most cases. Some of your install costs look high, but I think like solar panel install cost, actually installing a solar panel isn't expensive in labor, but you do have to build a structure, right? So there's actually, you know, costs associated with building the structure and getting all the brackets and stuff ready to put it up there. So, you know, you're probably kind of about right. Yeah, somebody else mentioned working with universities. You may have heard of Engineers Without Borders, and they do, they're at least in North America. I don't know if they're worldwide, but they'll do projects in other countries. What they've learned is, you know, they, as a team from a developed country, or if that's the right word anymore, you know, have to be careful to go in and install things because some projects need ongoing maintenance. In your case, like I said, it's just basically battery maintenance. The other stuff really never wears out. And so it's really important to have local people who do that. And I think the idea of training locals is excellent, and it's not as hard as it might sound because there's lots of online training available right now. You might have to have somebody, you know, show up and visit and work with somebody, and that's super powerful because then once they're trained, they can go around to different villages and places and do it. So the last thing I'll say is, if it's a situation where you're going to have solar via battery is making electricity at some point, and then the, you know, external power making the, you know, providing electricity at some point, then you do need kind of a more expensive sort of a switchover box, right, that knows when to switch over from one to the other. So then that would be an additional cost if you have that option of going between one and the rest. So anyway, excellent stuff. If you want any more feedback, comments, I'm happy to provide that. Thank you.
Thank you.
And then we have one last person who raised their hand is Ms. Alejandra.
Yes, hello. I raised my hand, but a lot of what I wanted to touch upon has also been said already. First of all, congratulations. I think this was an amazing presentation. I kind of just wanted to echo what Elena talked about with regards to the business plan to make this a more exciting investment for investors. So one thing that I didn't see you kind of try and dig into is the cost of that human life. So, if you can increase healthcare for these people, you're increasing the life expectancy, you're increasing productivity. So really digging into that aspect of it can also help investors. If we're training these people to be able to be technically inclined and able to manage these solar panel system, then you're increasing, the capital value of these people as well. So just thinking of it from that perspective as well. But congratulations, really great job.
Jim Walker. Yeah, no, I just to echo that, it was a great presentation, and I was struck right at the beginning with the nice strategy set up by kind of, you're not trying to boil the ocean. You picked health clinics as like a kind of a doable, focus thing that you could kind of tackle. So I think that was great. Up at that strategy level, and this is echoing what the other Jim was saying about, does the clinic itself have enough devices that need the electric in the first place? And so I guess just my only thing to add here at this point is in your strategy and in your storytelling, I think this is a health initiative that's going to be driven by solar. In other words, it's easy, like you could kind of frame this, solar is going to bring the healthcare, but I think focus on that health need, because when you first started, I thought, your guy's going to go home and he's going to have a mobile phone that's going to check his health at home or something. So I think, frame up your strategy. This is a health initiative driven by solar, and we're going to use the technology to kind of build out the healthcare. And I think that will kind of keep you focused, that the solar is a means to the health end, not the other way around, if that makes sense. But yeah, great job. I've seen a lot of these over the years, and your strategy and setup was, very clear, and then all the supporting stuff was great.